What is narcolepsy? Narcolepsy is a chronic sleep disorder characterized by overwhelming daytime drowsiness and sudden attacks of uncontrollable sleep. It can happen anytime during performing any type of activity. People with narcolepsy find it difficult to stay awake for long periods of time, regardless of the circumstances. In a typical sleep cycle, we enter the early stages of sleep, then the deeper stages, and finally rapid eye movement or REM sleep. People with narcolepsy go into REM sleep almost immediately in the sleep cycle and sometimes while they are awake. There are two types of narcolepsy. Type 1 narcolepsy comes with a sudden loss of muscle tone that causes weakness and makes you unable to control your muscles. This is called cataplexy. Type 2 is narcolepsy without cataplexy. Most often, narcolepsy is not diagnosed and therefore is not treated. Narcolepsy symptoms. In REM sleep, we can dream and have muscle paralysis, which explains some of the symptoms of narcolepsy. Those symptoms may include excessive daytime sleepiness. In general, EDS makes it harder to do everyday activities, even if you got enough sleep at night. The lack of energy can make it hard to concentrate. You have memory lapses and feel depressed or exhausted. And cataplexy can cause problems ranging from slurred speech to total body collapse, depending on the muscles involved. It's often triggered by intense emotions such as surprise, laughter, or anger. Hallucinations. These delusions can happen at any time and are often vivid and frightening. They are mostly visual, but any of the other senses can be involved. Sleep paralysis. You may be unable to move or speak while falling asleep or waking up. These episodes usually last a few seconds to several minutes. Disrupted sleep. You might have a hard time staying asleep at night because of things like vivid dreams, breathing problems, or body movements. Narcolepsy causes. Experts don't know what causes narcolepsy. They think it involves multiple things that come together to cause problems in your brain and disturb your REM sleep. Scientists are getting closer to finding genes linked to this disorder. These genes control the production of chemicals in your brain that may signal sleep and awake cycles. Some experts think narcolepsy may happen because your brain has a hard time making a chemical called hypocretin. They have also found problems in parts of the brain involved in controlling REM sleep. Risk factors for narcolepsy include your age. Narcolepsy usually begins between the ages of 15 and 25, but it can show up at any age. If you have a family history of narcolepsy, your risk of getting it is 20 to 40 times higher. Narcolepsy-related conditions and behaviors. Some people with narcolepsy also have related problems including periodic limb movement disorder. Your leg muscles move without your control many times during the night. Sleep apnea. Your breathing often stops and starts while you sleep. Automatic behavior. You fall asleep during a regular activity like driving, walking, or talking. You continue the activity while asleep and wake up with no memory of what you did. If you have any of the symptoms, please consult your doctor for a better advice. This is it guys for today's video. Please give it a thumbs up and share it with others. And subscribe to my channel. Thanks.